as a leader, once you've spoken, it's a brave person who's going to come out and disagree with you, or, and if you really want to get to sort of interrogate an issue or a decision and really pull in a diversity of perspectives on it, as a leader, you're probably wise to talk last and talk less.
Hello and welcome to the Dragon Tree Podcast. I'm your host, Chris Hobson, and on this show, we speak with great communicators to find out the secret of their success. Today, we're very fortunate to have Dr. Geraldine McGinty. Dr. McGinty is professor of clinical radiology and population health sciences at Weill Cornell Medicine and is an attending radiologist at York-Presbyterian Weill Cornell Medical Center. And I've known Dr. McGinty for probably over a decade now. So it's been my honor to know her, and I'm so happy that she's joining us today because I find her to be just one of the best communicators I've ever worked with, physician or not. So thank you for joining us today, Dr. McGinty.
Well, thank you for that very nice introduction, Chris.
Absolutely. Today, I'd really like to talk, yes, about you being a physician and how you're such a kind of a legend in the field, but I'd also like to talk about your communication style, which is, as a professional communicator myself, I've always really gravitated to. So I was wondering on that physician piece, if you could just tell us a little bit about your background and I guess what first interested you in pursuing a career in medicine.
I'm the child of two nurses, both of whom managed to gain a professional career despite very challenging circumstances in both of their childhoods. And I think it's no secret that at least my dad would have loved to have been a physician. So I think that was really influential. And we were a healthcare family. So I think my thoughts always were gravitating towards healthcare. And I made the decision quite early because I went to medical school in Ireland where it's a 6-year program straight from high school. So you make that decision as a 17-year-old. And I'm glad to say that medicine is such a huge umbrella. There are so many possibilities for what you can do. So I'm very fortunate to have found within that big umbrella a place that really works for me, for my interests and what I think I'm good at.
Excellent. And that is, just to be clear, a radiologist, a breast imager first and foremost, but as you've gone on in your career, as we'll see here in a minute, also an educator and an advocate and a specialist in healthcare economics. So, well, before we get into your role so much as a communicator among medical professionals and your academic colleagues, I know that this would be your preference too. I wanted to talk first about patient communication because I know that you really foreground that in everything you do. So I wonder if if you could break it down for us, how do you actually ensure that you're always communicating as clearly as possible with patients?
Well, I'll start by saying that it's really a learning journey. I think being an active listener, I think I can always do better at that. But, I'll say that I thought I was a pretty good communicator. And then all the physicians at Weill Cornell New York Presbyterian a number of years ago, we all did a patient-centered communications course. And one modification that I added to my practice, which honestly was a game changer, was instead of asking patients, do you have any questions? To ask them, what questions do you have? So I'm always looking for modifications like that can help me make my patients feel more comfortable and make them feel like there's space for them to ask that additional question that they might not feel comfortable with. So yeah, always learning.
Well, I read recently where you advocate for leading through influence and sort of the importance of building allies, if you want to get anything accomplished. So I think when we think of communicators, sometimes we think of just like a lone person communicating out into the world. But I'm actually really intrigued by your idea of building coalitions to carry messages forward. I was wondering if you could talk about that and maybe how it's benefited you in your career, both as a physician and as an educator.
So my career was a little bit backwards in that I had a really significant operational role, pretty much my first real job out of training. Big budget, big team. And in the last, I would say, certainly since I've been at Weill Cornell, I have not really had a team. I've worked with teams. I've been sort of a faculty lead for teams, but my work here is much more about influence. I support the dean on the clinical mission. The clinical chairs do not report to me, they report to him. but it's important that I help them achieve their goals and help them achieve the organization's goals. So I'm always looking for ways to understand how I can help them with what's challenging them, how I can help them build success, and build, and again, sort of as you say, build those relationships. Because especially when there's something difficult that you need to communicate, you never want to be meeting someone for the first time around a difficult issue if possible. Right. And then I think also, I think my background in advocacy at the college, thinking about the ways in which we had to look for other professional groups, professional societies that shared our goals, look for lawmakers, policymakers that shared our goals. So we were always trying to find our allies and understand how we could move forward through those coalitions.
That makes so much sense. And another part of what I read in my research before this talk was for our conversation is that it's like a marathon, I think, if I'm not misstating how you've put it, which is that it's kind of like on a daily basis, you have to really maintain those relationships. It's not like a one-off thing, and sometimes it is, but in most cases, do I have that right? Do you cultivate those relationships, and how do you do that? I guess. Do you have a rule of thumb?
It is something I share with those I mentor. It is a little bit tactical. It's making sure that you're touching base with people in your network on a regular basis, and often that is, here's a paper I read that I thought you'd be interested in, or here's a paper I just published that I think you'd be interested in, or I just saw you got a new job. I just reached out to somebody today who I heard got a new chair position, and to say congratulations, just to be really intentional about fostering those relationships. Because again, I don't think that you can meet people on difficult issues as effectively unless you've really built those connections, built those relationships.
Well, part of being, and you actually brought this up earlier, active listening. I was wondering if you could talk a little bit and spell that out a little bit more, because I think some people think of active listener as someone, the opposite of the person who's just waiting to talk and jump in. And that's probably a crude definition. So in your opinion, what makes a good active listener, and how should we go about doing that?
Well, again, I'll say I'm on a journey. I'm impatient. But I think especially when you get into leadership roles, because as a leader, once you've spoken, it's a brave person who's going to come out and disagree with you, or, and if you really want to get to sort of interrogate an issue or a decision and really pull in a diversity of perspectives on it, as a leader, you're probably wise to talk last and talk less.
Interesting.
Yeah.
No, I love that. And actually that a little bit, speaking of being a leader, that kind of plays into my next question about mentorship, which I know from working with you in the past and paying attention to your social media feed is a big deal for you. You seem to be a person, and I'd love to hear your take on this, who values both being a mentor and being a mentee. And I've talked to lots of people who consider maybe they're more senior in their jobs, but they learn just as much from mentees or people maybe lower than them on the rung, maybe younger people, as they do from mentors. So I just wonder where you fall down on the subject of mentor and mentee relationships, as far as being a good communicator.
I'm very much in favor of this concept of reverse mentorship. And I love the story of Audrey Tang, who was, and I think is still, the Minister for Information in Taiwan. And when she was appointed, I think she was potentially the youngest cabinet minister, but she got the leadership to agree that every cabinet minister would have a mentor who was in their 20s. So to really tap into what the younger community was thinking. So for me, I'm really interested in the perspectives of my younger colleagues. But, there have been some really specific things I've written, I think, about my colleague, Dr. Elizabeth Arleo, who is, earlier in her career than me, but definitely had already progressed significantly up the academic ladder and was an absolute lifesaver when I was going through the academic promotion process. I came back to academia after 11 years in private practice. And I mean, to call it imposter syndrome about the promotion process would have been an understatement. And she literally, just took me step by step and went through my CV with me. And so, tangibly, there are things that, I have very much benefited from, but a lot of it's perspective. And I think certainly when I've been supporting efforts like Elizabeth's on parental leave, I'm not a mom, and I'm also, even if I were, I'm further along in my career. So I probably have some more flexibility that our earlier career colleagues don't. So it's really important that I understand the perspectives of people who are dealing with some of those issues.
Yeah, and that's such a good point too from everything you said, but also like almost like a technology perspective. I feel like technology has just ramped up so quickly. I know for sure in radiology that's also the case, and maybe there are people who are specializing in certain aspects of the specialty that didn't even exist, a handful of years ago. I have to imagine that the younger people maybe coming up, the younger professionals or just coming out of med school, I wonder if those people won't be sought out more and more as almost like
I
reverse
thought I was
mentors.
up to date on all the social media stuff, Chris, and I do occasionally dip into TikTok, but I don't think you're going to find me on TikTok anytime soon.
Well, you say that, but I'm definitely going to keep an eye out.
Yeah, you never know.
I never know. I wonder, we touched a little bit on it earlier, but if you could kind of spell out, how do you deploy your highly trained communication skills when it comes to teaching? Because I know it's one thing to do something and then another thing to teach it. Whole different skill set.
Yeah.
How do you go about that?
I'm laughing because my students from a couple of years ago in the business school, one of them created a song about their business school experience, and I am a line in it. Cold calls from Professor McGinty.
Oh no!
I never
just because they needed a rhyme, right? That's the only reason.
Yeah, maybe. But I think a lot about that. I work really hard on my teaching, and I try to really think about who the class is, really tap into the different personalities. My classes are very interactive, and we curate the class in that particular MBA program to be a very diverse set of healthcare perspectives, providers, non-providers. So I think a lot about who is in the class. And I also think about the choreography of the class. Where am I standing? The sort of cadence of the class, of the day that we're together. When are we feeling energetic? When are we going to slow it down a bit so we can think a bit more? So I do give it a fair amount of thought to make sure that it's a really positive experience and positive learning journey for the students.
I've never heard anyone refer to it as choreography. That's so interesting. I that's totally new, like teaching, but it makes sense. And it's almost like you have to hit your marks as an actor if you want to keep people interested. I'm sure there's a lot more to it than that, but I'm just visualizing you in a classroom.
There is, and look, I'm not going to say I invented this, but there's a lot of material on, for example, teaching the Harvard Business School cases about where you stand in the room if you want some crosstalk between the students, that kind of thing. But I will say that even I'm thinking about having the time I had to teach my class online during the pandemic, and again I really thought about how do we keep focus, how do we keep energy level up when we're remote, and really tried to sort of set up my room so I was as close to a real classroom setting as possible, and quick chunks of content. And so it really has to be, I think, a very you have to put a lot of thought into it to keep people energized and engaged.
For sure. And as somebody who runs a podcast, I can very much relate to trying to keep the energy level up when you're not in person.
Yeah.
So you posted this really interesting message. It said, foundational to my mission as an educator is a goal to empower those I mentor and teach to drive meaningful change in healthcare. So I think we've talked a little bit about the mentor part of it and why it's important for learning, but could you talk about how it's also important for, like we talked about earlier, carrying messages forward? Not that you're, telling them what to think or say, but do you have sort of I guess, how do you go about doing that?
So a lot of different ways. I mean, some of it is sponsorship. Some of it's getting them on the committees where those decisions are being discussed and made, or where we're thinking about those issues. Some of it, since I rotated off, the ACR leadership has been showing our, early career faculty and trainees, this is how the policy landscape or the policy process works at the ACR. This is how you actually get a resolution. This is who you need to get on board. This is how you engage with people. So some of it's sort of being a guide and knowing the process really well. Some of it, honestly, Chris, and with some of the issues that we've dealt with over the last couple of years, like reproductive rights and family leave, has been my own willingness to speak up and to put myself out there and to try and be seen to be building coalition. So it's a lot of different ways.
Yeah. So, yeah, what you're talking about, it's communication and it's hard work communicating, but there's a fair amount of small p politics. It sounds like, how do I get this person to hear? And not that you're have some grand vision, but that there's so many moving parts. It's not just conveying a message. It's figuring out the best route for that message. Is that, if I restate
It
it that
is,
way?
and going back to the reproductive rights discussion, we did that essentially in two parts, and not intentionally. But the first one was, okay, we understand that there are now situations that our members as radiologists may find themselves in where they're feeling constrained on giving the best or evidence-based care because of increasingly restrictive laws around this in certain states. And so we chose to focus on that, the idea of interfering in the practice of medicine and the patient physician relationship. Um, it wasn't that we shied away from using words like abortion, but we tried to figure out what is it that's meaningful to this community. What is the value that we share, or what is the activity we're coming together around, which is our practice as radiologists. So we were, I hope, thoughtful about understanding what would be meaningful to the people who were considering this resolution.
Very good. Yeah, and you're talking there about like the end user too. So it's like you have this vision, and then but you carry it all the way through to the end with, okay, who ultimately is this for? Is that also very
Yeah,
important and top of mind? The
yeah, absolutely. And
mhm.
the other thing is recognizing that you go into things like a policy vote or a legislative process without a guarantee that you're going to come out on the other end with a vote in your favor. And that's the ACR Council, it's Congress. But there's also value to surfacing the discussion and using that time to get people on board. And, I always try to say that if we don't get a yes this time, we take what we learn and we do even more stakeholder engagement next time, and we come back again.
Yeah, I love that. I heard recently somebody said a no is just one step closer to a yes. So I don't know if you share that opinion or not, but I thought that was pretty accurate.
You have to be persistent.
Yep. Don't take no for an answer. Well, I'm also interested, you do a fair amount of publishing as well. And like I mentioned earlier, I know your voluminous work on economics in the field. So, I was wondering, how do you always ensure that this is a healthcare, and we'll talk about this in a minute, is such a complex and issue in American healthcare is so complex. So when you actually talk about economics vis-a-vis the healthcare system in America, how are you, I find you to be a very clear writer when I've read your material. How do you always ensure that you're being communicating on the page just as well as in person?
That is a really great question. I just published a paper in the Journal of Breast Imaging on developing financial acumen, and kind of went through sort of different stages in your career. What are the resources you should tap into, and what kind of knowledge should you have at your fingertips to be effective? Um, and I think I'm probably reasonably good at being a little bit reductionist. You don't have to know everything, and there's sort of layers. If you want to go deeper, you can always go deeper. But what is sort of a minimum viable amount of information that you need to know? But I also think when I'm speaking, and I think to some extent writing, for me, it always comes back to, like, what is a problem that you see in the healthcare system that you want to solve? Because I think invariably there's going to be at least a partial economic component to that. So, my journey in economics started because I realized that we were getting paid different amounts for two patients having the same study based on their insurance. And, really figuring out, how do we give care to the entire community when we've got these wildly different amounts that we're getting paid? So I think when you start with an issue or a problem that's resonant, then you can start to understand the economic underpinnings with some context.
And so, yeah. And I wonder, you mentioned earlier your business classes that you teach. Do you, speaking of keeping that end user in mind, there's just so much. I mean, you can such a constellation of aspects of the system. How do you decide what high points to actually hit? Like you said, there you can have that shorthand, but like, how would you even know where to start with that? That
Well, actually, the two classes I teach in the business course are a leadership course and a course called Healthcare Innovation and Transformation. And what I see my role as is preparing our students to be leaders. So especially when it comes to the transformation and innovation course, we do look at some examples of successful innovations, and we look at some examples of innovations that failed pretty spectacularly. But at the end of the day, I'm trying to help them develop the set of skills and tactics so that they can drive change. So I don't have to tell them everything about healthcare to help them understand how some people have managed to navigate the healthcare system to be successful in driving innovation. Does that make sense?
It totally makes sense. Yes, it's almost like, tell me if you agree with this, but is it teaching them kind of how to think critically about an approach, as opposed to this is how you'd approach this? Is it more of just a way of thinking almost?
Yes, it is a way of thinking. It's a way of looking at problems. I mean, I always say that, business school taught me a different way of approaching problems. Medical school is often about, I have to be the smartest person in the room and I have to know everything. Business school is, who do I bring around me? How do we think about this problem? And what does success look like for us? And of course, in medicine, you are often dealing with acute life or death emergencies. There's very few of those in the business world. So I acknowledge that sometimes the decision making has to be different.
Yeah, and it's about building those coalitions. Like, it seems to be like a big theme throughout our discussion today is building those teams. How do you get the right people and the right personalities? And I think so much of that comes down to being a great communicator. So thank you for bringing that back to the main theme here. Whether it's conveying the key role radiologists play in healthcare, or the significant role, say, something we kind of alluded to earlier, something like artificial intelligence will eventually play in healthcare. What do you think, if I had to ask you, if you had to kind of give me your mantra of being a good communicator, what would that be?
I think it would probably be know your audience, and listen to them. And be prepared.
Sort of like a two-way.
That's mantras. That's multiple, but
no, that's great. That's great. We'll go with that. And I like the two-way nature of that. It's not just it's like a one-way track of a message. It's you're being responsive. So I would agree that is a good mantra. So just to wrap up here, Dr. McGinty, I just wanted to know, if there's one communications tip that maybe not everybody knows about, but you feel like is very important to your success, what would you say that is?
I think it would, I'm not sure I could distill it down to one, Chris, but
that's okay. That's fine.
It's definitely using the in-between time to maintain relationships, and learn about people, understand what their hopes and dreams are and what drives them and what's on their mind. So a lot of maintenance of one's network. And then again, know your audience.
Excellent. I think that's a great note to end it on, Dr. McGinty. Thank you so much for joining us today. And if anyone wants to continue this really interesting discussion, where should they find you? I mentioned you're on LinkedIn. Is there anywhere else that people can look you up and start a conversation?
Yeah, I'm on LinkedIn because that other platform that I used to be quite active on, I can't be on anymore. A lot of hate on that platform. That's not for me. I'm a little bit on Threads.
Okay.
I'm on Instagram as RadEqual for that initiative. And I do have a newsletter if anyone wants to sign up.
Oh, that's great. Would it be okay to put a link to that in the show notes? And
sure.
Okay, we'll direct people to that. Thank you for joining us today.
Thank you for having me, Chris. Enjoyed the conversation.
Me too. Thank you so much.